Swine flu has filled medical clinics and hospital wards across India. Already this year, the H1N1 virus that causes the illness has killed more than 600 people and over 8,000 have tested positive.
There's no cause for panic, but there is cause for worry, and we have to be careful and we have to keep track of this, because usually the H1N1 influenza season ends by this time as the temperature increases, but this time unfortunately it hasn't done so yet.
Swine flu has claimed the largest number of lives in the states of Rajasthan and Gujarat, but cases have also been confirmed as far north as Jammu and Kashmir and Nagaland in the northeast. The health authorities say the airborne nature of the illness and dense population of India's towns and cities means outbreaks like this are hard to contain. The increase in the number of swine flu cases in recent months has health workers here worried. To help control the outbreak and avoid more in the future, they've decided to take preventative action now. That means educating millions of people, particularly the poor, about the illness and what symptoms to look out for. With cases rising by the day, health workers say they're struggling to reach people fast enough.
People have very little knowledge of this disease. They take it to be a regular fever. They take generic fever medicines and thus do not get the right diagnosis in time. Then the disease is incurable.
Awareness has grown, particularly among the wealthy, and as a result, so too have the number of people coming forward to be tested. While some experts say that's good, others fear the added drain on limited medical resources.
Yes, there's definitely more panic, more fear psychosis than what it should be, because most of the swine flu is part of influenza virus, and only patients who have an underlying disorder like diabetics or hypertensives or pregnant women or patients on chemotherapy or heavy smokers or having a chest infection, etc., they need to be treated or they need to be taken more care of.
Doctors have been careful not to call this an epidemic, but what the authorities describe as a seasonal outbreak is again testing India's health system. In the process, it also highlights the vulnerability of millions of people. Nidhi, Dutt, Al Jazeera, New Delhi.